The purpose of this teaching video is to discuss a condition called a macular pucker. It also goes by the name of a macular epiretinal membrane or an epimacular membrane, and some people call it a wrinkle of the retina. To understand how this problem occurs, it's a good idea to look at a model of the eye. Inside the eye, there is a tissue that lines the back called the retina. The retina is actually part of the brain, and it's connected to the brain with by this optic nerve. There's a jelly that fills the eye called the vitreous humor, and that's stuck to the retina when you're born. As you get older, the vitreous gel begins to shrink and it pulls away. And when it pulls away, sometimes it doesn't let go cleanly of the retina. Instead, when it pulls away, it pulls a little crack in the surface of the retina in the center, the macula, where your finest reading is done. And the body's response to that is to grow scar tissue over that crack. And if you've ever had a cut on your arm or your skin, you know that as scar tissue heals, it pulls the edges together. The same thing happens in your retina. When the scar over this crack heals, it contracts and pulls the edges together such that the retina becomes wrinkled up like a pucker piece of cellophane that's been puckered. And that leads to distortion of vision, blurred vision, and no pain. These patients with this condition come in saying that over time they've noticed that lines look curved instead of straight, and that they are not able to read as fine print. Well, the treatment for this, when it gets bad enough, is to surgically remove this jelly. The way that's done is to make 3 small holes in the white part of the eye, one for an infusion line, one for a light, and one for a cutter, and under a microscope to cut out this jelly, and then with a fine forceps to peel off the scar tissue from the surface of the retina. And then with time, the retina that had been bunched up unfolds, smooths out, and vision begins to improve. Patients typically see better than they did before the surgery. 90% of the time the vision is improved, although seldom to perfectly normal. Most patients, even after surgery, have some residual distortion, but they say that it's better than before the surgery. Approximately 1% of patients will have complications such as a retinal tear or bleeding or further scar formation, and very rarely infection inside the eye. Patients who have a natural lens will find that cataracts are accelerated after surgery for a macular pucker. Patients who've had cataract surgery before developing a macular pucker don't have that problem. The surgery takes about 1 hour and is done as an outpatient procedure. Typically, patients would not go to sleep for the surgery. If you have any other questions after hearing this video, I would refer you to the information document on macular pucker found on this website.